About a year ago, I started having neck and shoulder pain that slowly turned into nerve pain and dizziness, red hands, a whole list of symptoms that no doctors could explain to me. It took almost a year of wrong turns, and I was finally diagnosed with something called neurogenic thoracic outlet syndrome. So before I start, I just want to say that I'm not a medical professional. This is not medical advice. I'm just sharing my personal experience and the path I went through to get diagnosed. Everyone's situation is different. So please, talk with your own doctor about any symptoms or medical concerns. I will be looking off to the side because I did write my own notes. The medication I'm on does cause a little bit of memory and kind of stumbling with my word problems, so I just decided to write everything out. So hi, my name is Stefanie. I just wanted to share my journey because getting diagnosed took a long time. It involved a lot of confusion along the way. And if sharing my story helps even one person, then I think it'll be worth it. So at the start of all of this, February 2025, I was 30 years old, about to turn 31, fairly active. I lifted weights regularly. I went on long walks. I tried really hard to take care of my body. At the same time, I worked a really desk-heavy job. So between that and my online MBA program, I was at the computer about 8 to 12 hours a day. So I did do everything I could to offset that. So I have an ergonomic chair with like armrests on there, lifted armrests. I have a sitting standing desk. I even had a walking treadmill underneath it, so I can get movement in during the day. My posture hasn't always been perfect. I do have a larger chest. I tend to look down when I walk, and I've always had to be mindful of my slouching, but I was actively working to improve it. So in January of 2025, my husband and I took in some extra additional stress. We took in our 12-year-old niece. We didn't have any kids before that, so this was a major change for our lives and for hers. Around the same time, we enrolled her in some ice skating lessons. So that meant several nights a week of like 30 to 45 minutes drive after work, sitting in that cold ice rink for an hour, and then driving home late. I even stayed and skated with her a few times early on, but I never fell. I never had an accident. There was no injury. There was like one moment where I kind of lost my balance and I almost fell, but I did not fall. And I didn't think of anything of it at the time. So I just wanted to be clear about that. There was no trauma, no car accidents, no sports injury. Nothing happened to me physically that explains what came next. Before all of this, my medical history, it was pretty unremarkable. I think when I was 21, I had a go-kart accident that resulted in a small bulge disc in my lower back, between my L4 and L5. I did have spinal injections. They helped significantly. And since then, it's only flared like up occasionally in my lower back. And I don't take daily medication for it, just like Tylenol as needed. But it sometimes causes sciatica, the pain that like kind of radiates down either leg, but it's been manageable for years and doesn't affect me. Aside from that, I also have some tummy problems. I have prescription for Zofran for nausea, because it's always been an issue for me. As a kid, I get frequent dizzy spells, and I had a history of fainting, although I haven't fainted since high school. I had one surgery, an appendectomy, nothing else. And I also have a history of migraines, mostly hormonal ones. A couple with migraine with aura, where you like see splotches, but usually just the kind where I kind of need to lay down for an entire day and feel foggy afterwards. So anyways, mid-February, with a chaos of like work, school, becoming a new caretaker to a 12-year-old, I started noticing tightness like in my trap back here and pain in the right side of my neck. So like my trapezius. And then at first it just like felt like tension, It was getting really worse when I was driving or sitting at my computer or sitting at the ice rink. I experienced something similar a few years back, and it was when I started a new stressful job. And back then, but like once the stress leveled out, I fixed my ergonomics. I stayed consistent at the gym. It eventually went away. So that's what I assumed it was. But this pain didn't like stay in the shoulder. it traveled down my right arm and into my pinky finger and the finger next to it as like a tingling, zinging sensation. So I could ignore it. So it started feeling like a little bit more, you know, once it started going down the hand. I didn't feel it really fully down the arm, maybe just a little bit here, but mostly into here. And my neck became really stiff. Like, it was really hard for me to turn my head to the right. It started to feel locked up. So on February 10th, 2025, I took myself to the urgent care. At that point, I thought it was something straightforward, like maybe a muscle strain or pinched nerve. They kind of thought the same thing. They did an x-ray of my cervical spine. Everything looked normal. I was given like one of those like anti-inflammatory shots in the butt and sent home. A few days later, my symptoms got worse. So the pain in my neck intensified. I started experiencing what I can describe as like shaking electric, like a shaking electric pain in the back of my head. At that time, I didn't really have a name for it. I've done some research and talked to some doctors. They call it occipital neuralgia, which basically means there's a bunch of like the nerves at the base of your skull that kind of go up to the back. They're really like irritated or tightened or inflamed. So I went back to urgent care. This time they ran more tests. They performed a CT angiogram of my brain and neck. They did an ultrasound of my thyroid for some reason. I'm not entirely sure what they were suspecting. They did an MRI. At that point, everything came back normal. So they started me on oral steroids, again, thinking this, you know, might be a pinched nerve but instead of improving, I kept getting worse. So by February 23rd, the pain in my neck was so severe that I couldn't drive myself at this point. I returned to urgent care with my husband. This time, they did another MRI of my cervical, thoracic, and lumbar spine. So once again, everything came back normal. There was nothing structurally wrong that I should follow up with my, they said just, you know, go see a specialist, neurologist. So at this one point, nobody had an explanation. I'm having all this pain. I can't move my neck. They don't understand why. They keep asking, like, was there any sort of injury leading up to this? And I just kept saying no. At this point, I was under the care at Kaiser. And on the surface level, it's pretty efficient, right? The test came back quickly. It's all in-house. It's all under one roof. But, you know, if something doesn't fit neatly into one of their boxes, the system kind of struggles, right? I personally, only opinion on my end is that Kaiser's kind of like the Walmart of healthcare. They have everything there, but none of it's that great. But that's just my own experience. I know some people love it. So, did not work for me. So I tried to search on my own, right? I saw other people online were using cervical collars, like soft collars. I'm thinking maybe I got whiplash, right, from like almost falling on the ice rink. And I put it on, and it was just one of the cervical soft collars, and it helped so much because my head felt so heavy, like I was dropping my head, and it felt like I couldn't keep it up myself, like a drop neck, and I couldn't understand why. But once I put the soft collar on, it felt much better. This is an ice pack. These are both ice packs right now. But once I would take it off, you know, the nerve pain was still there. Like, it was all there. It was just kind of helped it. I felt really weak. The pain in the back of my head was the most unbearable. My hands felt like wrong. So one day, so it was February 27th by this time, everything, like, I felt horrible. I told my husband I need to go to the hospital. My hands felt wrong. I felt dizzy. So on the way there, I was just really overwhelmed. I just felt panicked. I'm not sure if I was having an anxiety attack or panic attack from the pain, or if the anxiety was causing the pain. But I was wearing the soft cervical collar. I briefly took it off when I was like waiting to be seen at the hospital. I literally fell to my knees. I dropped to the ground. It felt like electrical bolts were going through both of my hands and up the back of my head. It was like my nervous system had short circuited. So in the hospital, when they finally saw me, they noted that my heart rate was elevated, you know, and they just kept saying, oh, are you stressed out? Are you anxious? And I'm like, yes, but I am telling you, I can feel electric shock sensations. And I'm super weak, and that doesn't make sense, right? So they admitted me overnight. They did extensive testing, right? So they did blood work. I had elevated white blood cells. And I'm sorry how I pronounce these because I am not a medical professional, but neutrophils, immature granulocytes. But basically everything that I have indicates stress, inflammation, or like tissue damage, right? So they were just like, you're stressed out. They did chest x-ray, a transthoracic echocardiogram, MRIs in my brain and brainstem, more blood tests. And they even tested for conditions like myasthenia gravis. It's like a muscle condition, but nothing came back. So they did informal positional testing. So when I stood up, my heart rate would jump about 30 to 40 beats almost immediately. I would become dizzy. I had already been experiencing dizziness when walking or standing and often needed to sit back down. They didn't formally diagnose anything at the time, but it looked very similar to POTS, which I've had a lot of. My grandpa has POTS, and I've had a lot of signs of POTS over the years, positional autonomic positions. So basically, like your heart rate spikes when standing, your blood pressure can drop. My blood pressure already runs pretty low. It's like about 95/65 just when resting, with a high heart rate. And it was like really high. My resting heart rate at this point was consistently like over 100, 110 rest, and then I would stand up and it would jump just from standing, and it would stay there when I stayed standing. The hospital doctor who discharged me was really dismissive. I was essentially told there was nothing wrong, I can go home. I was still in significant pain. Walking felt difficult. I don't think there was anything structurally wrong with my legs. It felt more like my nervous system was kind of overwhelmed. It was just like really like exhausted overall. And also I think my sciatica was kind of acting up by then. So after I got home, I ordered a rigid cervical collar, so like a harder collar. And that really did change everything. It helped so much. It supported my head. My symptoms were improving noticeably. I was still mostly in bed, but at least I could like stay sitting up. I set up my computer in bed. I was able to work short periods. I wasn't driving yet, but my body felt more stable, calmer. Like I had an external support. Like I needed that external support, and my body was being overloaded by not having that. So, and I was wearing it off and on, you know, I didn't want it to like atrophy or anything. But at this point it was pretty clear that it was nothing urgent or life-threatening, right? My nervous system slowly settled, like, okay, you're not gonna die. But there was left with a huge question. If nothing was wrong, why did supporting my neck feel so good? Like, what was going on? After the hospital, what happened was, I think of it as a loop, and it happens with a lot of people with neurogenic thoracic outlet syndrome. Cardiology, neurology, pain medicine, back to neurology, do it all over again, right? So cardiology monitored my heart because of my dizziness and my heart rate spikes. I wore a Holter monitor. I kept a detailed journal. The results showed episodes of tachycardia. The same times I wrote down that I felt dizzy or lightheaded, usually after standing up. Nothing structurally wrong with my heart. No arrhythmia that explained anything. Just a pattern that looked very positional, like POTS. Although those Holter monitors don't detect POTS, they can show the pattern of POTS. So neurology focused on the nerve pain. So even though I didn't have a clear diagnosis, nothing showed up the pain. One neurologist prescribed gabapentin. I started at 900 milligrams a day, so 300 3 times a day, and it helped a little. Well, it helped a lot, and I was like, you know, this seems to be really helping after about 3 or 4 weeks. Then they said, well, you know what, you can actually take more than that, let's double it. So they did 600 3 times a day, so I'm at 1800 milligrams a day, and that's when I really felt a big improvement. So the nerve pain in the back of my head and through my pinky and ring fingers, it just dampened, like it quieted. Like I could still feel it, but it wasn't shooting like an electric bolt. It was more like fuzzy, like if your hand was to fall asleep, but like a painful one. It's hard to explain, but the intensity dropped. It dampened the pain, right? So I was able to stop using the cervical collar. I feel like after I gave my neck a break, because you could quite literally see at different times my scalene muscles, especially on my right side. My left side started hurting too, but my right side, you could physically see them spasming. But once I wore that, neck brace, I was able to stop using it. But what was really frustrating is no one could really explain why the gabapentin was helping. They weren't treating a diagnosis, they were treating symptoms. So for the first time in months, my pain was more manageable, but it wasn't sitting right? Like I'm still in extreme pain. I would get flare-ups when it would be worse. And at this point, it was pretty clear that I reached my limits of what Kaiser could offer me. So I wasn't getting worse in an emergency sense, but I wasn't getting better either. I was just passed between departments without a plan or a theory that connected my symptoms. I did physical therapy and acupuncture and massage, really just like the works. And then I started researching on my own. So a lot of what I found led me back to the idea of something called cervical instability, particularly through a company called Caring Medical, right? So when you're using AI to research your symptoms as well, it's trained on the internet, and Caring Medical is all over the place. So everywhere when you search unexplained like neck, neurological symptoms, dizziness, autonomic issues, I connected with somebody at Caring Medical and seriously considered going to Florida for treatment to get prolotherapy injections. Instead, I did find a doctor closer to home in Orange County, Dr. Patel. He practices regenerative medicine. I got to go see him. He did a pretty thorough evaluation. He's really nice. I like him a lot. His thought was that I might have mild cervical instability. He could kind of see it in the MRIs, but to him, even it said it felt like a stretch, like it wasn't clear as day instability. For him, he recommended some prolotherapy along with some steroid injections into my trap muscles in my upper back, and then the prolotherapy in my neck. So I went ahead and went forward with it. I did 2 rounds, one in June of 2025 and one in August of 2025. The ones in my muscles were extremely painful, I will say. The ones in the back of my head were fine. Ones in my muscles, like he literally said my muscles were like jumping. So to be fair, it did help. I think it's because just tearing up those muscle knots, you could literally hear the needles going through it. I was driving again. I wasn't using a cervical collar anymore. I was back at work. I did take the summer off of school. Things had stabilized a lot. Felt a little bit more normal again, but this time I was also on gabapentin for a while now, and I'm not sure what was helping. Maybe all of it was. But the pain never went away. I still had flare-ups. I'm still using ice packs, right? When I say flare-ups, my body just felt unpredictable. It was exhausting to manage, deeply frustrating. Felt like I was just doing everything right and not getting my life back. And I started to really question, like, is this really cervical instability, right? Is this the root cause? Can mild instability cause this much ongoing pain? And I don't want to be on gabapentin forever. There's long-term associations with gabapentin and Alzheimer's and so many other bad things. At this time, my sister-in-law, who's a physician in another state, she casually mentioned thoracic outlet syndrome. So I brought it up to one of my doctors at Kaiser. The response was immediately dismissive. I was told that I don't have thoracic outlet syndrome because I don't have an extra cervical rib. Anyway, I accepted that answer at the time. Looking back, I wish I'd gone back to my sister-in-law, and been like, she would have told me that an extra rib is not required for thoracic outlet syndrome diagnosis. I didn't know enough to push back, right? I'm just throwing everything at them at this time. Could it be this? Could it be this? Instead, I went to an out-of-pocket physical therapist I'd heard a lot of great things about. He worked with me a few times, focusing on my neck, my shoulders, my jaw, my chest, opening my chest up. During one session, he asked me if I'd ever heard of thoracic outlet syndrome, or TOS. I told him, yeah, but I don't have it because I don't have an extra rib. He stopped me right there. He showed me an image of right here, the brachial plexus and the thoracic outlet. So he explained how compression can happen without an extra rib, especially with posture and muscle tightness anatomy. He told me that based on my symptoms, there was a lot of pinching happening in this area. So I think that conversation really changed everything, right? At this point, my hands weren't turning red yet. There was nothing on any of my scans or physically showing on the outside of my body. There's the complete invisible illness. The gabapentin was quieting the nerve pain, so a lot of my symptoms were muted. But what he described lined up with how my body felt in a way that nobody else had explained. So I went home, I started researching TOS on my own. I switched off to Kaiser and I got onto a PPO plan so I can go anywhere. I joined a Facebook group for people with TOS, and for the first time I was reading stories that sounded like mine. The pain patterns, the neck and the shoulder and arm heaviness, the nerve systems, the dizziness, the long diagnostic journeys. So it all lined up. So I looked at their list of specialists. I called UCLA to try to see Dr. Gelber. He's like the top TOS surgeon in SoCal. The wait list was 6 months for a consultation. I couldn't wait. I'm like, oh my God, I just can't wait. Instead, I scheduled with Dr. Farley, one of his colleagues. Probably a bad idea because by the time I walked into the appointment, my symptoms were changing again. Around this time, my arms, whenever I drop them down to the side, so my hands will turn immediately red and blotchy. Sometimes there's patches of white mixed in, and they blotch here, all through my fingertips. If I lifted my arms up like this, the color will return to normal. My right arm also just got even heavier. Like it felt like it weighed 10-20 pounds more than it should. My left side has symptoms too. My right arm and shoulder and neck were just clearly worse. I'm right hand dominant. So it was just really this is when I saw Dr. Farley, right? So at this point he did something called a ruse test. It's essentially where you put your arms like this and you open and close your hands for about 3 minutes. The goal is to see if holding that position produces any of your symptoms to get worse. He told me to hold that position for 3 minutes, and I believe he left the room, so I couldn't even make it anywhere close to that. Within like 20 or 30 seconds, my arms were in intense pain. My hands feel like they were on fire. My shoulder was screaming. It feels like fire was just shooting through my hands. At that time, I didn't notice the color change yet, but the pain alone made it impossible to continue. So Dr. Farley ordered a scaling block. For this procedure, they inject a local anesthetic into the anterior scalene muscle in your neck. The idea is that if the muscle is compressing the nerve in the thoracic outlet, temporary numbing it should relieve the pressure and your symptoms should improve. So doctors use this as a way to determine whether someone is a candidate for thoracic outlet surgery. Now, just because it doesn't work doesn't mean they won't move forward with surgery, but they like to use that as like a marker. So I went ahead and had the procedure done. Unfortunately for me, it did not help at all. The position that they had me in, without my head supported, laying back on the bed, it put me into a flare, like on the other side of my neck too. And the area just felt really numb for a short time, but the pain never improved. Within 20 minutes of driving home, things felt worse for a few and then went back to normal. I followed up with Dr. Farley over Zoom. He essentially told me he could send me back to neurology. And at that point, I was really frustrated, right? So my symptoms lined up almost perfectly with thoracic outlet syndrome. But the way the appointment gone felt really dismissive. Around the same time, I saw on the TOS support group Facebook that Dr. Farley was no longer seeing thoracic outlet patients, which made that whole interaction make a lot more sense. So either way, I knew I needed another opinion. So Through my research on the support group, I found Dr. Ali Azizadeh at Cedars-Sinai in Beverly Hills. He specialized in thoracic outlet syndrome. He trained under Dr. Thompson, which is like one of the #1 surgeons as well. So I scheduled an appointment October 2025. This appointment was really different. He had a full team of people, like 4 people behind him. He reviewed my entire history, every test I've ever done. He made sure I had completed all of the standard workups first, like the imaging. Kaiser had done a nerve conductive study with me. I'd already done that. He had me perform the ruse test again for him. This time I had them, like, they were standing. They were all intently. So when I do this, and the lighting isn't the best here, but it doesn't take long before this hand starts turning pretty dang white and blue. And this one turns, I can't do it for that long, it hurts. And I bring it down and the color kind of returns, but essentially that's what happened. And I dropped my hands, I feel a nerve pain. He told me to try to do it as long as I could. I lasted about a minute. He, after reviewing everything, he told me that I do indeed have bilateral neurogenic thoracic outlet syndrome, as well as Pec minor syndrome. And I was a candidate for the decompression surgery, which is a trifecta surgery. For the first time in a year, the story, it all made sense. So thoracic outlet, it's a narrowing between your collarbone and first rib, where a bundle of nerves called the brachial plexus, along with major blood vessels, travel from your arm, your neck to your arm. When that space becomes compressed, it can cause nerve pain, weakness, heaviness in the arm, circulation changes, dizziness, and a long list of other symptoms that are often hard to detect on standard imaging. So in my case, the compression for me is the nerves, hence the neurogenic thoracic outlet. So once Dr. Azizadeh confirmed it, he said I am a candidate for surgery, which is a first rib resection. So they take out the first rib, scalenectomy, and a pectoralis minor release. So basically they're trying to give more space for the nerves and blood vessels that run from your neck into your arm. So when they remove that first rib that sits right underneath the collarbone, the rib isn't necessary for stability, and just moving it opens up the space significantly. When they remove part of the scalene muscles in the neck, they can contribute to compression, and then they release the pec minor, which can also pinch the nerves further down near the chest. So Dr. Azizadeh performs the surgery through a small incision near the collarbone and another small incision near the neck. The goal is to just free those nerves from anything compressing them, take off any scar tissue, all that. So he originally scheduled my surgery for January of 2026. And that's kind of when insurance became a nightmare. So because the surgery involves removing a rib, insurance companies, they classify it as an amputation procedure. And under those guidelines, many amputations are considered outpatient surgeries with just like a short observation period. But this surgery is very different. When they remove a first rib, it's close to the lung. There's a real risk of a collapsed lung. And because of that, surgeons monitor patients carefully afterwards. They often place a small surgical drain to remove blood or fluid from the area. Patients are kept multiple nights for monitor and pain control. I was told that I'll have a pain pump used after surgery, and that recovery can be very painful. Sorry, it's kind of hard to, after I've been sitting for a while, it's hard to swallow. Every member of Dr. Azizadeh's team was really upfront about the pain. The PA told me the same thing. It's not going to be an easy surgery. Recovery is going to be rough. Everybody's experience is different, but for neurogenic, when you're dealing with so many nerves, I guess it can be particularly worse. So my insurance company didn't see it that way. They approved the surgery itself, but they denied the hospital stay. I appealed the decision, denied. I appealed again, denied. Dr. Azizadeh's team will not do it unless the after stay is approved. So eventually I had to file for an external review, which means an independent medical reviewer outside an insurance company evaluates the case. So I was able to call and get an expedited external review, so that kind of like pushed through it faster. But in December, the nerve pain in my hands had become so severe that I just couldn't type. I couldn't deal with the pain all day sitting like this. It's very painful for me. My job is entirely computer-based. I had to stop working. I paused my online MBA and essentially stopped doing anything that required me to use my hands for long periods. When I stopped working, my symptoms improved like significantly. They got a lot better. The pain in my hands decreased noticeably because I wasn't spending hours at the computer. At the time, I thought I would only be out a few weeks because I expected to have surgery in January. Instead, the insurance delays pushed my surgery all the way to March. So now it's March 3rd or 4th. I'm recording this. My surgery is scheduled for March 18th, so I'm 2 weeks away. We're starting on my right side. Interesting, during the test, my left hand, it shows more dramatic color changes. It can turn pale or bluish during the bruise test. But in terms of what I feel day to day, my right side is significantly worse. That's where the pain started. That's where the heaviness is. That's where the nerve pain in the pinky began. Dr. Azizadeh said that when deciding which side to operate on first, patient's symptoms matter just as much as the test that they're seeing visually. So basically my right side is what's affecting my daily life the most, and that's what we're treating first. So the plan is to eventually operate on the left side as well. Dr. Azizadeh recommends waiting a few months to see, like, between surgeries. We want to see how I recover for the first one. I was seeing from like the online group that people say 6 months, but I'm just gonna see how my first one goes and I'll make my decision later. Right now, the focus is getting through the first one. So that's where I'm at right now. I just wanted to share my story before surgery and talk about my road to diagnosis, because getting here took almost a year and a lot of confusion along the way. My surgery is coming up and I'm hoping it'll finally fix the root cause of everything that's been happening. But, thoracic outlet syndrome has a few different types. There's neurogenic, there's venous, there's arterial. You can do some research on each of them. I'm only going to speak on neurogenic because that's the journey I've been living through. But I think it's important to mention there are multiple types that can present very differently. So thank you so much for taking the time if you got all the way through this. If anyone comes across this video and has questions, I'll do my best to answer them. And honestly, like I said at the beginning, if this reaches even one person and helps them feel closer to a diagnosis or feel less alone or just kind of feel heard, I hope sharing my story will absolutely be worth it. And I hope to share my experience for my surgery and my recovery afterwards. And maybe I'll do a video as well about some of the devices that I use that have helped me along the way. So yeah, thanks for sitting with Steph here.